We're 1 week into much eased COVID-19 restrictions here in South Korea, with the alert level reduced from critical to alert. Are we really back to where we were more than 3 years ago? And are we ready to enjoy a virus-free summer? For more, we're joined by Dr. Alice Tan this morning. Good morning, Doctor.
Good morning.
Can we really say that we have fully returned to pre-pandemic life 3 years ago? If yes, how so? Can we be completely relieved this summer?
Well, I think the answer depends on who you are. So if you are a young, healthy, vaccinated person, then for the most part, you've returned to normal life. But if you are at high risk of infection or high risk of developing severe disease if infected, your lived experience might be different. I think you may be still following precautions against infectious disease, and you're probably avoiding high-risk areas, wearing a mask, and preventing overcrowded situations. So it depends on who you are in terms of how back to normal your life is. But I think that's perhaps the wisest approach forward. It's not a one-size-fits-all situation right now.
Exactly. I still see a lot of the elderly and also young kids wearing masks on public transportations, especially.
Right,
now,
I think that's a good idea.
Right. It's always good to be preventive. And now the number of new virus cases has been on a downward trend recently. Should we expect to continue to see that trend?
I think in the near future, so speaking about COVID-19, in the near future, we do seem to be beyond the peak of the latest surge. So the peak in new cases occurred in the second week of May, and the peak in new COVID deaths occurred in the fourth week of May. The effective reproductive number has been less than 1 for the last 2 weeks. So I do expect in the near future that we are beyond the peak of the latest surge. When you talk about respiratory viruses, of course, we also talk about influenza, and for influenza as well, it does seem like we are beyond the peak of the second wave of influenza that we saw in the spring. So that does seem to be the case for the near future, but we can't really predict what will happen long term. The disease has not, COVID-19 has not disappeared. And so in the future, there may be future surges.
Right, and that's exactly in line with our next question. We have to keep in mind that viruses like COVID-19 can come and go at any time. Then how is the South Korean government working to prevent future medical emergencies like the recent pandemic?
That's a great question. So the South Korean government has released a strategic plan for pandemic preparedness, which is mostly in line with the proposed plan of the WHO for pandemic preparedness and also the United States pandemic preparedness plan. And it goes over 5 broad topics against 24 projects. And the five topics are surveillance and prevention, prevention and recovery, also infrastructure, healthcare infrastructure, expansion, and research and development. So basically, we want to prevent the next pandemic from ever happening. But if we were to have a situation where we have the emergence of a pathogen of pandemic prevention potential, we want to be able to address it quickly, make sure that we protect the vulnerable groups, and have vaccines and therapeutics available in a timely manner. The goal is 100 days to a new vaccine and 200 days to new therapeutics. A couple blind spots, though, I found in the new proposed plan are, I don't think it addresses the environmental stewardship and the animal to human interface as much as it should. And also one area is cross-cultural or multinational communication domestically for emergency responses. I think that's one area that needs to be highlighted more in the next plan.
Right, especially with lots of visitors from overseas returning to the country, especially during the holiday season. Now, it's the first summer of the so-called post-pandemic era, like I mentioned earlier. How do you expect this summer season to go by? Because I hear many people, including the elderly, are going back to activities like swimming lessons these days. So how will this summer go?
So certainly we're seeing a rebound in people returning to leisure activities. As you mentioned, such as swimming, gatherings are happening at full speed, wedding parties, people are having reunions in restaurants and homes, outdoor activities and indoor activities are in full swing. I would ask, though, that people remain mindful that, as I said, the risk of COVID-19 severe disease has certainly decreased. But the US CDC, they recently released a report on the vaccine effectiveness of the bivalent COVID-19 vaccine. And what they saw is for healthy adults, during the first 2 months, vaccine effectiveness against hospitalizations was pretty high at 64%. But starting from 3 to 4 months out, that dropped to 24%. And so we do have still the problem of waning of immunity. The virus remains highly mutable. In other words, it continues to mutate. And so even though we are enjoying our lives again, we should stay mindful that the risk has not completely been eliminated. There are still 100 people in ICUs, more than 100 people in ICUs due to COVID-19, including 3 children and adolescents. There were 150 deaths due to COVID-19 in the last 5 weeks alone. So it is something that we still need to be mindful of.
Right, being mindful despite in this endemic era, but still it's the first summer with no masks completely, so that's exciting.
Absolutely.
All right, Dr. Ellie Stan, thank you so much for your insight this morning.
Thank you for having me.